Healthcare is more than just coverage. It's about innovation, care, and accessibility. iCare is committed to making quality healthcare more accessible and tailored to the needs of every Filipino. My advocacies have always been close to my heart. Whether it's environmental sustainability or public health, I believe that real progress happens through partnerships and collaboration.
Since 1991, iCare continues to grow with purpose, expanding its reach and services to serve more Filipinos. At iCare, we provide tailored healthcare solutions that support both businesses and individuals. With rising medical costs, we help our clients manage expenses through smart cost management, ensuring they receive the best care without setbacks. Say yes to reliable healthcare. We stand for innovation, care, accessibility, reliability, and excellence. Because healthcare isn't just a service, it's a commitment.
With iCare, you get a partner who takes care of you today and secures your well-being for the future. Say yes to better health.
iCare has a 35-year track record for providing affordable, high-quality healthcare solutions to Filipinos. The trusted HMO is a better health partner to top employer brands across industries such as IT/BPM, BPO, FMCG, hospitality, retail, real estate, and professional services. In 2020, we were recognized as one of the Circle of Excellence recipients for the Leadership Team of the Year award in the Asia CEO Awards. In 2023, we were named by Statista and the Philippine Daily Inquirer as one of the top 25 fastest-growing companies in the Philippines, the only HMO included. In 2025, iCare became the only Philippine HMO to win at the Insurance Asia Awards and was selected by Harvard Business School as a Field Global Capstone Project partner. Currently, iCare has more than 50,000 accredited doctors and medical practitioners nationwide. For broader coverage and accessibility, iCare offers 13 more hospitals and 38 more clinics in hard-to-reach areas such as Ilocos, Negros Oriental, Iloilo, Naga, and Davao, among others. In 2025, we reached the 1 million milestone, built one decision at a time and one yes at a time. Since 1991, iCare has grown over the years, creating strong partnerships that encourages innovation for a smarter, better health experience. In 2023, Value-Based Healthcare, a group of Singaporean doctors, joined the picture. This partnership created a new blended identity of Singaporean efficiency and discipline, rooted in the Filipino tender loving care. With this new ownership, iCare launched its own telemedicine consultation service, Telemed 7. It is supported in Viber, offering 24/7 consultations. Currently, iCare ranked first in terms of number of accredited hospitals and clinics. In overall health provider network, iCare is top 2. Now, let's talk about iCare HMO Prepaid Plans and its emergency care series. In 2019, we introduced the Prepaid Sachet-type health plans, which is designed to cover health services for specific illnesses and conditions that are affordable and accessible. iCare's prepaid health plans cover emergency cases, medical consultations, diagnostics, and laboratory procedures. Currently, 74% of iCare's prepaid HMO plans' buyers are women, aged 35 to 44, and mostly from the National Capital Region. Around 59% of engaged buyers are coming from digital ad inquiries. Prices for iCare's prepaid plans range from 100 pesos to 30,500 pesos, depending on the products availed, with more than 30 variants to choose from. Prices depend on the type of coverage and covered cases, including emergency care, outpatient and inpatient services, medical consultations, and laboratory and diagnostic procedures. iCare's bestseller prepaid plan is Care All-In, which is a one-time use prepaid plan with up to 100,000 pesos annual benefit limit for emergency care services for emergency cases due to accidents, viral, bacterial illnesses. The benefit limit covers doctor's professional fee, laboratory and diagnostic procedures, emergency room care, room accommodations, medicines required in the hospital, surgery and the surgeon's fees when medically necessary, use of the operating room, recovery room, and ICU as medically necessary, required special modalities of treatment subject to 5,000 pesos standard limit, hospital cash allowance of 1,000 pesos when confined for adults. 1-year unlimited telemedicine consultation for kids. If you want an access to the top 6 hospitals in Metro Manila, add 700 pesos on top of your ER Care All-In Adults total bill. For top 6 access for ER Care All-In Kids, add 2,000 pesos on top your total bill. It is eligible for 1 to 64 years old. ER Care Booster is a one-time use prepaid plan with up to 100,000 pesos annual benefit limit for emergency cases due to accidents, including inpatient and outpatient. The benefit limit covers doctor's professional fee, laboratory and diagnostic procedures, emergency room care, room accommodations, medicines required in the hospital, surgery and the surgeon's fees when medically necessary, use of the operating room, recovery room, and ICU as medically necessary. Required special modalities of treatment, subject to 5,000 pesos standard limit. Hospital cash allowance of 1,000 pesos when confined for adults. If you want a top 6 access, add 700 pesos on top of your total bill. 18 to 64-year-old adults are eligible for this plan. If you are looking for a prepaid plan that covers outpatient emergency care for accidents for as low as 700 pesos with a benefit limit of 50,000 pesos, ER Care Basic is the perfect healthcare solution. It covers doctor's professional fee, laboratory and diagnostic procedures, emergency room care, medicines required during emergency care. Adults aged 18 to 64 years old are eligible to get this plan. ER Care Choice is the perfect prepaid health plan for those looking for protection for their short-term plans, with coverage periods of 30, 60, and 90 days. It covers emergency cases due to accidents, viral, bacterial illnesses, including coverage for doctor's professional fee, laboratory and diagnostic procedures, emergency room care, ward room accommodation for all variants, medicines required in the hospital, surgery and the surgeon's fees when medically necessary, use of the operating room, recovery room, and ICU as medically necessary, required special modalities of treatment subject to a 5,000 pesos standard limit. With automatic access to the top 6 hospitals in Metro Manila, namely Asian Hospital and Medical Center, Cardinal Santos Medical Center, Makati Medical Center, St. Luke's Medical Center, QC and BGC, and the Medical City. Adults and seniors aged 18 to 70 are eligible for this plan. Price starts at 100 pesos. iCare also has a prepaid HMO plan that caters to specific diseases, like Dengue Flex. You can purchase this plan for 500 pesos. Dengue Flex covers dengue fever, leptospirosis, and COVID-19 with a benefit limit of up to 50,000 pesos. Dengue Flex covers doctor's professional fee, laboratory and diagnostic procedures, emergency room care, ward room accommodation, medicines required in the hospital, surgery and the surgeon's fees when medically necessary, use of the operating room, recovery room, and ICU as medically necessary, required special modalities of treatment subject to a 5,000 pesos standard limit, with automatic access to top 6 hospitals in Metro Manila, namely Asian Hospital and Medical Center, Cardinal Santos Medical Center, Makati Medical Center, St. Luke's Medical Center, QC and BGC, and the Medical City. Adults and seniors aged 21 to 70 years old are eligible for this prepaid health plan. School-age children can get the same coverage with iCare's K-12 health cover for only 1,000 pesos. Get coverage for emergency cases due to dengue fever, leptospirosis, and COVID-19. K-12 health cover covers doctor's professional fee, laboratory and diagnostic procedures, emergency room care, ward room accommodation, medicines required in the hospital, surgery and the surgeon's fees when medically necessary, use of the operating room, recovery room, and ICU as medically necessary, required special modalities of treatment subject to a 5,000 pesos standard limit. With automatic access to top 6 hospitals in Metro Manila, namely Asian Hospital and Medical Center, Cardinal Santos Medical Center, Makati Medical Center, St. Luke's Medical Center, QC and BGC, and the Medical City. Children aged 1 to 20 are eligible for this prepaid HMO plan, with a benefit limit of 50,000 pesos. We always define emergency cases as a sudden, unexpected onset of illness or injury, having the potential of causing immediate disability or death, or requiring the immediate alleviation of severe pain and discomfort. Meanwhile, accidents are defined as a visible, external, and violent event brought by a physical or natural cause and occurring entirely beyond the member's control, causing damage to the health of the member. Viral and bacterial illnesses are defined as diseases caused by viruses and/or bacteria. Here are some of the common samples of coverable illness under ER Care series. Here are some things you should know when using your ER Care plans. Coverage is based on the final diagnosis of the doctor. General exclusions are still applied. No physical card. The plan is represented through a health e-voucher sent via email. Pre-existing conditions are not covered. An illness or condition is considered pre-existing if prior to effective date of coverage. A. Any professional advice or treatment was given for such illness or condition. B. Such illness or condition was in any way already known to the member. Or C. The pathogenesis of such illness or condition had already started, of which the member may not be aware of. To use your emergency care prepaid health plan, follow these steps. Go to the emergency department of an iCare accredited hospital. Present your voucher and a valid government ID to hospital staff, the ER staff to verify your membership with iCare. An ER doctor will assess you to provide the necessary treatment. If hospitalization is required, you will be admitted based on your room category. Additional charges not covered by your plan should be directly settled with the hospital.